Let me win this one.
We're live.
Good afternoon, everybody. This is Ben Cordova, president of GMI. I have with me Paul Schreiner, vice president of human resources.
Hello.
Today, we're going to focus our energy talking specifically about COVID-19. I think I would be remiss, though, if I started this conversation without first thanking all of you. I am incredibly proud of the work that all of you have done and all of you continue to do. I've always believed that people who go to work in the security field certainly don't do it for the money, but do it because they enjoy helping people. And this is an opportunity for us to really assist a lot of people. And I couldn't be more proud of all of you and how well you stepped up and the amount of dedication that all of you have shown over these last 2 weeks. Now, depending on what you hear on the news, the next several weeks may be more of the same, could be potentially worse, could be potentially better. But regardless of that, the primary thing that I want to talk about today is your personal safety and what you need to do and what we're trying to do to assist you to be safe while you perform your essential function. Okay. First and foremost, I want everybody to follow the CDC guidelines. They've been laid out. I think you've all seen them, but I do want to go over them with you all just to make sure you understand them. Okay. Whenever possible, stay home. Okay. This is not a time to be going to the parks or the beach or any of those other places right now. So stay home whenever you can. Okay. Whether you're at work or you're at home or you're at the grocery store, maintain your space. This virus travels through the air. We've all been told, we've all been shown and heard the 6-foot rule. Now that should be familiar to you guys already because you've all should have been trained on the 21-foot rule. So if you're following the 21-foot rule, you should be good. Okay. So let's make sure we're maintaining our space and let's cover our face. Let's make sure that our faces are covered. Now, what's interesting about face covers that I want everybody to understand is it really is a two-way protective barrier. Yes, it's designed to protect any possible bacteria or infections coming in on getting into you, but it's also equally designed to keep anything that you might have from moving out. So the protection of our face is not just about protecting ourselves, it's about protecting everybody that we're around, including ourselves. Okay, so that's number one. First and foremost, please, please, please follow the guidelines. Number two, if you fall into any of the demographics that are considered to be high risk, and those demographics change. I saw yesterday, I saw a couple things that came out that kind of concerned me. One was obviously we all know that people who are 65 or older fall into a high risk demographic. I know that some of you are out there at 65 and older and still working. Now, we're not going to stop you from working, but we would highly encourage you to please consider, if at all possible, self-isolating and maybe taking a leave of absence. We've had some of our older workers take a leave of absence. And if you fall into that group, I want you to feel comfortable taking a leave of absence and know that your job will be protected and it'll be available for you when you come back. But I don't want you to be in fear of losing your job. If you fall into that group, I want you to consider a leave of absence. Number two is anybody who has pre-existing medical conditions. The ones that they're mentioning most are hypertension, diabetes, and anybody who's gone through cancer treatment. If you have any of those pre-existing conditions, again, potentially you may want to consider a leave of absence. And again, your job will be protected. And then what I saw yesterday kind of bothered me, and I don't know that this is true or not true, but it was something that was on the news yesterday, was that at the current time, African Americans are being infected at a higher rate. Now, that's your call, but if you fall into any of those demographics, again, considerably less. Okay. And then last but not least, on your personal safety, I want everybody to wear their PPE, their personal protective equipment. Now, we have several thousand sets of these gloves that should have been distributed to all of you. Okay. If you have not received these gloves, I want you to immediately call your branch operations and reach out to them. I can tell you personally that I've delivered several thousand to each branch, and I know they have them. It's important that you wear these gloves. And then we went out and we purchased 1,500 N95 face protections. Those N95s are the ones that the medical professionals use. Okay, those should have been distributed to you by now. If you have not gotten an N95, again, reach out to your branch and tell them to get you one right away. Okay, and now the third phase, what we're doing now, and I want to show you guys these, is we're lucky in that we have some folks who work for us who are seamstresses, and they've begun building reusable masks, cloth masks that can be washed and reused. So we have several different types based off of size and of the person wearing the mask. But these are going to start going out tomorrow. Okay, the Orange County and Los Angeles people will be getting them first. I just sent, I think, about 70 up that way, and I'll be sending some more up tomorrow, and then we'll be getting these out to the San Diego folks. But these are reusable. They can be washed. They can be worn. The N95s are disposable. They can be reused depending on how well you take care of them, but they're not really designed as a permanent solution. These are. So if you have the N95, wear the N95. If you get one of these, wear it, wash it, and you can use it again. Okay? So please, 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 everyone, use your PPE. You may want to consider hats. If you don't have one of these masks yet, consider a scarf. Okay, but please, I want you to protect yourself. Okay, so that's really what I wanted to focus on primarily today. But I know a lot of you have a lot of questions about economics and what's happening to your income. And we really want to make sure that we protect your income and allow you the opportunity to make money during this time when most people don't have jobs. Okay. So first and foremost is I want everybody to know that you have all been declared essential service workers. As an essential service worker, that gives you the right to work. Okay. You should have received already through Human Resources an essential service workers letter. Carry that letter with you so that if we come to the point where we go into quarantine or a more strict lockdown and they start stopping people, you'll be able to provide that letter to a law enforcement officer to demonstrate that you are in fact an essential service worker. Okay, so it's important that you have that letter with you and start getting a habit of carrying it with you. But you are essential service workers, which means that we're going to continue to have work. Okay. Number two, in order to protect your income, it's going to be really important to understand the conditions that your customers face right now. Most of the businesses that you are protecting are not producing revenue and are not producing income right now. Your retail centers, your office parks, they're not making money. And they're spending the money that they don't have on you because they feel like it's important that their assets be protected during this time. So it's going to be critical that you give them a high level of service, okay? Because if they're not getting the level of service that they need, then they're going to start cutting essential service out. And we don't want that to happen. We want you guys to be able to continue to make to produce a wage and salary. So it's really important that you're giving them great service. Protect their assets, okay? treat those assets as if they were your own. It's really tough for our customers right now, and they're really struggling with just being able to keep their businesses open. And remember, they're the ones who paid the bills. And as long as we're giving them great service, they'll continue to pay for security because it's important. But if they feel like they're not getting their money's worth, they'll at least be tempted to begin cutting those services. And nobody wants that. Okay? Okay. We have hours available. I'll repeat, we have hours available. Okay? If you need hours, reach out to your branch, reach out to your schedulers. Now, we have more people applying for jobs than we have ever had in the history of this company. So there's a lot of people who are out there looking for your jobs right now, okay? But we have those hours available to you, okay? So if you need hours, I want you to reach out and get those hours, okay? If the time should ever come where we don't have hours, or we only have partial hours, then you may have to consider going on unemployment. Now, we're not there. I don't think we're going to be there. I think we're going to be fine. But if that time comes and you have to reach out and get unemployment, I think it's important that you understand what that means, because it doesn't mean what it meant 6 months ago. So I've asked Paul Schreiner to explain to us all how the new unemployment guidelines are going to work during this COVID-19 epidemic.
Yeah.
Paul?
So first, let me echo Ben's sentiments and thank each and every one of you for showing up to work every day. I know there's concerns and there's fears, and as we watch the news every day, as this virus, continues to spread, but understanding that you're on the front line of this battle, and you're really playing an important part in reducing how many people get sick and getting our communities back on track to, where we can get some normalcy in our lives again. So again, thank you for that. I do get a lot of questions, and I appreciate the employees reaching out to the human resources team with their questions, so we could put your mind at ease, or we could put you in the right direction and help you make decisions that you may be struggling with. So as Ben mentioned earlier, if you're in that group that may be at a high risk due to medical conditions or at a certain age group, I really do encourage you to follow the CDC guidelines. They make these recommendations because of the past experiences that they've seen in other countries, China and Italy and Europe as a whole, and the mistakes that they made, where if they had acted earlier, they could have prevented the amount of deaths that they have, the amount of cases that they have, and they learned from those people and the mistakes that they made. So again, I encourage you to reach out to your doctor and make sure you're making the right decision if you do come to work. The other thing that Ben touched upon is pay, right? So I feel grateful every day that I'm in a business that we can continue to come to work. We can continue to collect a paycheck. We can continue to have somewhat of a normal life compared to most of the people in this country. So the unemployment issue in that playing field has changed drastically, like Ben said. And you can imagine when 2 million people lose their jobs over the course of a few weeks, what that's going to do to the system when you apply for unemployment. So the government is working quickly and swiftly to manage that, but it's a logjam at this point. So I've had employees tell me, well, you've cut my hours, you've reduced my hours. I think I'm gonna voluntarily take a leave of absence and go on unemployment. Well, you have to consider what the process is for unemployment. If you voluntarily leave when your company has hours that they can give you, you may not qualify for unemployment. Now, I'm not an expert and I don't work for the EDD, but it really is something to consider. And now, the other option is that while your hours may be reduced, you were used to working 40 hours at your site, now maybe you're only working 20. You can apply for unemployment to subsidize those hours that you lost due to a reduction in hours, and so that'll help you in the future. I was told 2 months ago, before COVID really, hit us and affected the unemployment office, the EDD office, that it was about a 21-day waiting period from the time you could apply for your benefits until you started receiving those benefits. I don't know how long that wait is today, but with the amount of people that are applying for unemployment, I can almost guarantee you that it's going to take a long time before you see any benefits. So please consider, if you're able and healthy enough to continue working, continue to go to work. Call your HR representative if you have other questions or maybe some other options that you're considering, and we'll help work through that with you. And then as far as the hours that we have available, security has never been more needed in this community now. And as Ben said, we don't anticipate losing hours, but it'll be at a site-by-site basis. So there may be an office building that we're working at that had to close down, and so they no longer need security. We may have more need at retail centers because they have a shopping center where they have a large amount of people and maybe some issues involving security that we can transfer you to. So keep in contact with your supervisors and certainly reach out to human resources for any and all questions that you have. We have sent out emails on a weekly basis, and we've set up a site that we post all of our messages to the employees on a website called Client Point. If you don't have access to that, please get in touch with HR and we can send you the links. It has just a ton of information regarding the laws that we're dealing with, regarding medical issues, all those things. So again, reach out to your human resources representative, questions, concerns, and we'll help work you through all that.
Okay. And then the next subject that I'd like to talk about is a subject that we've heard a lot about over the last few weeks, and that's the whole subject of hazard pay. Okay. So here's what I can tell you about hazard pay today. First and foremost, you have to remember that our customers do not have the money to pay hazard pay. Okay. We can't in good faith go and ask them to pay extra today because they simply don't have it. Okay. Well, what I have learned is the following. I've learned that the state of California is working on a set of benefits and incentives for people who are essential workers. I've asked Paul to look into that. He's researching that as we speak, that the state of California is creating some sort of program for essential workers with additional benefits and incentives. And I just saw yesterday on the news that in the fourth stimulus package, which they've just begun working on, that there is at least a possibility that they are considering essential service worker hazard pay as a part of that stimulus package. If that goes through, first of all, I don't know whether or not it's going to go through. Second of all, I don't know for sure that even though we're called essential workers, when they write the bill, they're going to make sure to include security in that bill. I hope they do, and we'll do everything in our power to make sure that they do. But those are all benefits and packages that are being worked on today. Okay, I understand your concerns. I understand why you believe hazard pay should be included. Unfortunately, right now, our customers just do not have the money to pay any additional fees. They're struggling with being able to keep their security programs up as is. But we'll continue to work on that and continue to keep you posted. Which leads me to kind of my last major category, and that is keeping you posted. What's funny about this, crisis creates opportunity, right? What's funny about this is I've wanted for a long time to be able to reach out and talk to you directly. And this crisis has kind of forced us to be able to come up with a way to do that. And I'm really excited about this whole concept of the town hall. But I want to tell you how we're trying to communicate with you today. Number one, I believe we have most of your emails. I think the last time I talked to Paul, we have over 95% of the guards' emails. So we are sending out email blasts consistently. Please make sure you're checking your emails for emails coming from GMI. We're trying to keep as much information flowing through the email blast system. Number two is we have eHub, which is the app that I hope all of you have on your phone, where we can send out additional messages to you. Okay. We've hired a social media manager who's building our social media presence so that we have additional communications. So if you check the GMI Facebook, you're going to see a lot more postings coming out through the GMI Facebook now than you've ever seen in the past. We've added a LinkedIn account to be able to communicate through LinkedIn. And we've got a new one that we've just created from an internal product called Client Point. What we're going to try to do is keep that live and send you the link. So once you have that link, anytime you click on the link, you would see the latest live data. For example, this town hall that we're doing right now will be posted on that link in the next day or so. And then once that occurs, all the other employees who weren't able to log on to the town hall will have access to the town hall. So those are the ways that we've built to be able to communicate with you through this crisis. But hopefully we're going to be able to continue that going forward, because I really feel it's important that the frontline officers and the executive team have the ability to communicate versus having to go through the telephone tree. So I want to keep this going. And one of the things that I'm committing to right now to all of you is that going forward, this town hall format is going to continue, and we're going to have at a minimum one of these a month. Now, hopefully next month we're not talking about COVID-19. Hopefully next month we're talking about benefits or how you get promoted or the 6 core values or something more important or more positive. But I wanted to take this one and focus it primarily on what I think is important right now, or what we think is important right now to you. And number one is your first and foremost is your personal health and safety. And number two is protecting the income and your wages that you have coming in right now to be able to support your families. So we're going to take a few seconds and look at any questions that might have come in.
Can I just add something real quick? So in regards to the hazard pay, one of the things I would like to point out with our company that I'm very proud of is we have not laid off or furloughed one single employee in this company throughout this crisis. Now, I'm not saying that's going to, be guaranteed to continue, but for so many companies in this state and in this county, in our areas, to close their doors and lay off millions of people, that's something I'm very proud of. The other thing I want to remind all the employees is that you have a lot of questions pertaining to what is the company doing for the employees, how are you following through? And as Ben said, we're doing our best to communicate that out. But I do want you to know that the executive team meets every morning, and we discuss everything that's going on within the company. We talk about the customers, we talk about the employee issues, we talk about how we can continue maybe to get some more sales out there with companies in the community that are looking for security services and technology and communication. So every single day, the management team is in communication with each other to try and keep this company running smoothly and helping the employees out. So do you want to take some questions now, Ben?
Yeah, sure. So I saw the first question was about hazard pay. I think I answered that, but let me just say it again. right now our customers cannot afford to have their billing rates go up and pay hazard pay. But the state of California is working on a program for essential service workers that is supposed to include benefits and incentives. And the federal government in the next round of stimulus has said that one of the things that they will be considering is hazard pay for essential service workers. As these programs move along, as Paul learns more about these programs, we're going to blast all that information out to you in the different formats that we just talked about. Okay, so look at those formats to make sure that you're getting the latest information.
So we get some medical questions, Ben. Ben and I are not doctors. We're far from being medical experts.
I do play one on TV though.
Yeah. So we do not want to give any advice on any kind of medical conditions. What we would do, or what our advice is, go to the CDC website, go to covid19.net.gov, and get the advice from the experts.
Are there any other questions? Okay. So last but not least, guys, be safe. God bless you. God bless your families. We're thinking about you every minute of every day. And we're going to do everything in our power to protect you, to protect your health, and to protect the income that you desperately need to be able to support your families. And I can promise you that that is what we are committed to doing, and that is what we work on every day here to make sure that we're doing the best that we can. If we're not getting you what you need, if you feel like what I've just said isn't a reality for you, I want you to reach out to the Human Resources Department right away and tell them if you don't have your PPE. Tell them if you don't understand something. Ask them the questions. That's what they're here for. They're here to make sure that you are being taken care of. Paul and his team are a dedicated team of professionals who I know really care about you. And they're going to do everything in their power to help you. I promise you that. Okay? Again, God bless all of you. I hope to see you soon under better conditions. And I hope you tell your friends and all your coworkers what you heard today. And we'll be putting this out on the different platforms tomorrow for everybody else to see who didn't log on tonight. Thank you very much. Take care. Thank you.
Thank you. Take care.